Good morning. Today I'd like to talk about the impact of obesity on embryo development. And this is a study published in October 25, next month, from a group in Israel. And so you may say a lot of studies suggesting an elevated maternal BMI in IVF is linked to an increased risk of miscarriage. So is it the egg or the endometrium, the chicken or the egg? And a bit of a spoiler alert, this paper we're going to discuss concludes the morphokinetic parameters and embryo quality as elevated by time-lapse monitoring appear to be unaffected by maternal weight, even in extreme BMI subgroups. And from their study, moreover, there's been no significant differences in implantation, clinical pregnancy, live birth, miscarriages across their BMI group. Now, everything's true except for that last observation of miscarriage, which is in conflict with other publications. So by way of welcome disclaimer, my name's James Stanger. I'm an embryologist with more than 50 years experience. These YouTube channel videos are my attempt to bridge the gap between information you may need for your fertility treatment and the most recent publications available to your clinic staff. That is, you're talking on the same page. I'm not a medical person, and this information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor and maybe to help in understanding the advice you receive. And as always, this page is allocated to a future supporter for IVF Daily. I'm just starting out, but if you want to promote your company or clinical product, this is a page where you may like to use. In supporting FirtAid's IVF Daily channel, your support may mean that an IVF client becomes a better informed IVF client. Click subscribe or become a sponsor or just make a donation to help others in their infertility journey. Okay, so let's look at this paper. Does obesity affect embryo development and quality? A retrospective analysis. This study compared morphokinetic parameters and development quality of embryos from a GnRH cycle, ICSI cycle, into 4 graph subgroups of BMI, less than 18.5, 18.5 to 25, 25 to 30, and above 30. The key parameters the authors were looking at were pronuclear appearance, fading, cleavage time to ameriloblasts, and synchrony of the second and third cycles. In addition, they're looking at the number of top quality embryos on day 3 and day 5. They had about 620 odd cycles with just under 1,800 viable embryos, and they concluded there was no significant difference in the number of retrieved oocytes, oocyte maturation rate, fertilization rate, number of embryos created, the rate of embryos discarded, or pregnancy rates among the different BMI groups. And importantly, there was no difference in any of the embryo morphokinetic parameters were found between the BMI groups, and no difference in the number of top quality embryos were found between the groups at either cleavage or blastid stage. And quite frankly, I think these studies that show no effect are as important as any study that does. It's really important to know when a factor has no impact on outcome. So the only inkling that there were some differences were when they're doing pairwise comparisons between the lowest and the highest BMI groups. There was just this faintest suggestion that the elevated BMI had a slightly longer fade time for pronuclear movement, and that's sometimes linked to the rate at which DNA pair has been obstructed in the egg. So once again, repeating the same slide, they could find no difference or no relationship between morphokinetic parameters and embryo quality in any subgroup. So let's just have a bit of a summary. I'll use some text I'm going to quote from this paper looking at frozen embryo transfers, which I'll discuss a bit later. And basically, the authors of this paper, by way of introduction, said obesity has been shown to negatively impact fertility. This impact is partially explained by an increased rates of anovulation amongst patients with obesity. However, cohort studies have shown a longer time to conception, even among patients with regular menstrual cycles, suggesting that other factors may be contributing. They quote a 2016 study of 250,000 IVF cycles performed through the SARC-CAUSE group, and they noticed diminishing pregnancy outcomes with increasing body mass, with the highest rates of miscarriage and the lowest rates of live birth were those with the highest BMI categories. And they make a point that 2 subsequent meta-analyses also supported those observations. So 2000, just citing a few articles, and these are mainly ones that were referenced in the original article. A 2016 article, systematic review, concluded that the maternal underweight is associated with a slightly increased risk of clinical miscarriage, similar to that of slightly overweight women, but a lot less than severely obese women. Another study done in 2000 in the JARP group, the Journal of Assisted Reproduction and Genetics, looking at body mass index and fertility impact, and they concluded that both underweight and overweight have a negative effect on IVF parameters and outcomes leading to decreased chance of pregnancy. They did suggest that the number of euploid embryos per patient decreased slightly with lower maternal BMI, but that was never been discussed in subsequent papers. They found the clinical outcomes were similar between normal weight and underweight women, but overweight women instead had showed higher rates of miscarriage per clinical pregnancy. So the effect on low BMI may be very minor. Another study looking at the effect of maternal BMI index on embryo development, this was done in 2019, and they concluded the assessment with time-lapse technology evidence that maternal BMI affected embryo development. They found that maternal obesity and overweight are associated with slower embryo development, something which is in contrast to the main paper for this review. They found no significant difference observed between groups regarding embryo morphology and pregnancy rate, but they also observed a slightly lower miscarriage rate in underweight compared to normal women. Another study looking at blastist formation, this is in 2021. They asked the question, does embryo development cleavage patterns and rate of blastist formation differ between normal weight and obese women undergoing IVF? And they concluded, again, that embryo morphokinetic development, final blastist formation rate, blastist morphology do not differ between obese and normal weight women. So in a 2022 review on BMI and miscarriage after IVF, the authors concluded that female obesity is related to poor outcomes in natural and assisted conception cycles, including an increased risk of miscarriage. Embryo morphology assessed by conventional means or morphokinetics does not seem to be affected by excess weight, with similar blastist formation and quality compared to normal weight women as opposed to obese women. Embryo euploidy rate is not increased, and high miscarriage rates are seen even after the transfer of euploid embryos into obese women. It appears that the disturbance of the uterus or its environment induced by female obesity seems to be the most likely cause of an increased risk of miscarriage, but although metabolomic, epigenetic, or mitochondrial oversight and embryo dysfunction cannot be ruled out. In the context of all the above, weight reduction before pregnancy should be advised in obese women trying to become pregnant. So let's look at the FET transfer data. This report was published in 2024, and 56,000 embryo transfers, enormous number. So the largest cohort to date, increase in BMI was associated with decreased pregnancy rate and live birth rates and increased pregnancy loss after euploid frozen embryo transfers amongst the whole group, and particularly amongst the group that are classified as PCOS. And just a small note, which hasn't been followed up elsewhere, is that these results were muted or attenuated amongst patients whose sole diagnosis was male factor infertility, suggesting that associated female infertility diagnosis and not BMI alone may underline this trend. So there was a very good summary in 2024 of 3 papers published in that issue of Fertility and Sterility 121, issue 2. So 3 papers in the one issue, one looking at autologous data showing a high impact of BMI on miscarriage rates. The second one, looking both autologous and donor data, also showed an impact of high BMI on miscarriage. And the third one was only looking at donor cycles, where there was no effect of donor BMI, but recipient BMI on miscarriage rates. So once again, this is all pointing to the weight having no effect on the egg or embryo, but only on implantation. But it's interesting, the authors then go on and say, well, okay, what are you going to do about it? And they note that previous bariatric surgery data studies are conflicting, but another study examining diet and weight loss demonstrated that weight loss did not improve outcomes in IVF. So most importantly, the ultimate goal should not be the live birth rate, but the birth of a healthy live-born infant and a healthy mother. So my take on these papers is that overall, the morphokinetic parameters and embryo quality as evaluated by time-lapse monitoring appear to be unaffected by maternal weight, even in extreme BMI subgroups. Miscarriage, despite the transfer of euploid embryos, means that the high BMI does not appear to impact on embryo quality. It looks like the endometrium is influenced by high BMI, and that both in fresh and recipient FET cycles, both all show an increased risk of miscarriage. Lower BMIs also show a smaller risk of miscarriage, but it's not less than elevated BMI. But looking at the whole thing, I agree with the last author's comments that the real question that remains unanswered is what impact does maternal BMI have on children conceived by IVF to obese females? I think I'll leave it there. Thank you very much. I'd just like to recognise that IVF is a personal journey that involves the actions of many different people. And it helps to understand all the different aspects on that journey. I hope this information may be of value. And if you like the information provided, please tell others or subscribe. And thank you very much.